A concerning look at the risks of cannabis to your heart health. Using cannabis could dramatically increase your risk of dying from a heart attack or a stroke, according to new research. Now, CTV's medical specialist, Dr. Marla Shapiro, joins us now to talk more about this. Dr. Marla, thank you as always for joining us. That's disconcerting, so worrying.
It's disconcerting for a number of reasons, because in a younger generation, and this study looked at 18 of age and upwards, cannabis use is replacing alcohol. So it's being used a lot, it's being used frequently, and it's unmonitored. So this study looked at medical data from studies of more than 200 million people, broad age group, age 15 or so, all the way to 59. It included people in many countries, Canada, US, Australia, Egypt, France, and Sweden. It didn't differentiate how cannabis was used. So in other words, if it was vaped, if it was smoked, or if it was consumed as an edible. But if you look at the numbers, the first thing that's important is in any observational study, it's not the same as a randomized trial. You can't take people and say, okay, you're going to be on cannabis and you won't be on cannabis, and let's see what happens. But when studies include over 200 million people and many, many different countries over a larger age group, the data results are quite powerful. It tells us that this is being observed, and the notion of cause and effect can then be looked at quite seriously. So really important to understand what the baseline of the study was.
Yeah, those are huge numbers. So what are the risks then? What do we...
Okay, so the risks are really not all that surprising, because when you look at the data and it looked at across these different age groups, what we saw was an overall increased risk of heart attacks, 29%. Particularly in younger people where they don't have pre-existing cardiac disease, and the overall increase of risk was 20%. And that was in users of any type, as we talked about waping, smoking, edible, consuming them, versus non-users. So those are dramatic numbers. Those are not small increments.
Do we know why, or were other factors taken into effect?
Yeah, so when you think about anytime you heat and then inhale, so think about smoking, what ends up happening is that you're consuming all these particular carcinogens and particulate matters. So it likely damages the blood vessel itself and can increase clotting, which we know is a factor that leads to increased stroke and heart attack. We know that the vascular function was reduced by 42% in marijuana smokers. So it means the vessels are not as reactive, they don't dilate nicely. And we saw that further vascular function reduction in about 36% in edible users as well. So those are big numbers, 42% and 56%. So we worry about those numbers.
Is there any safe amount?
So that's a good question, right? We asked that about alcohol for years. And now we're coming out with there is no limit of what a safe amount is. You know, we talked about 1 drink a day, and then it came down to 5 drinks and 3 drinks until we finally said we don't know what the lower risk of safety is. And I think the same thing here. We think of this as being recreational use, and that word recreational implies it's without harm, and that's a concern. The takeaway points here is that this is one of the largest studies to date on the connection between marijuana and heart disease and stroke. It raises questions about the consumption, exactly as you're asking, and whether or not there is a lower limit where you don't see cardiovascular risk. And I think what it's basically saying is that we need to ask about this when we are in our offices. We ask, do you smoke, do you drink, how much do you drink? We now have to be specific about cannabis use and say, if you're having cannabis use, are you smoking, are you vaping, is it an edible, how much are you having? And to be able to reflect and educate back to say that this is a product that is not without harm. You know, we are seeing harm in terms of vascular endpoint, both heart attack and stroke in younger people, and it's something that you need to be thinking about. And I don't think that we will be able to answer that question is there a lower limit where there is no harm?
Okay. Dr. Marla, thank you as always. Dr. Marla Shapiro is our CTV medical specialist.